Good morning, everyone. My name is Joshua, and I'm excited to be showcasing my capstone project in today's presentation. Today's presentation will be primarily focused on evidence based interventions for my mother in law, Lila, a 51-year-old woman who has been diagnosed with uncontrolled diabetes mellitus for over 25 years. Lila would report having an average blood sugar level consistently above 200 milligrams per deciliter, and her most recent A1C of 8.0. In addition, she is also diagnosed with morbid obesity and hypertension, partially due to her familial background and genetic predisposition, which are further intensified by her inactive way of life and unhealthy diet patterns. At first, she controlled her condition by taking antihypertensive medications and hypoglycemic medications on an infrequent basis. Nevertheless, by embracing her better health conscious behaviors, developing more opportunities for physical activity in her weekly routine, and implementing a continuous blood glucose monitoring device, as well as commencing a weekly schedule of Ozempic injections through her physician, she has recently experienced notable progress in managing her diabetes during the past year. Although Lila had first faced difficulties with the intervention plan, she now reports a more successful control of her diabetes by strictly following the recommended dietary adjustments and integrating the suggested exercise routines on weekends by walking multiple laps around her local park with her husband. She also started a conscious effort to decrease her consumption of high fructose drinks and simple carbs in her diet, while also actively exploring community resources to further acquire knowledge about her diabetes. Following her treatment journey for an accumulated 9 hours at her home in Boyle Heights, California, we delved into multiple aspects of her care, including financial costs, health concerns, preventative strategies, the utilization of newer technologies for her diabetes treatment, and compare my preliminary projected goals for the project versus the overall outcomes. Together, we went over the various causes of type 2 diabetes, including factors such as certain excessive dietary intakes of sugar, genetic predispositions, or the coexistence of various comorbidities such as obesity and hypertension. In addition, we also covered the various signs and symptoms of the disease, including generalized fatigue, nausea, polydipsia, and other notable observations. This is coming from Gilbert 2021. At the conclusion of today's presentation, I will provide insightful feedback on how this capstone project and the process of obtaining my RN BSN degree have impacted both my professional development and personal development. As a healthcare practitioner, I partner closely with Lila for our 9 hours together to develop and implement a specific diabetes management intervention plan. The aim was to evaluate the effect of the strategy on her overall satisfaction and assess the impact on her quality of life. Lila's continued participation was crucial for a comprehensive and impartial assessment of this intervention. Upon careful examination of her various lifestyle observations, it became evident that the tailored diabetes management treatment strategy had a positive impact on her overall well-being and standard of living. The personalized approach to managing her illness effectively addressed her specific needs, daily patterns, and lifestyle choices, significantly improving her overall happiness with the implemented adjustments. This is coming from Marie Lee et al. 2023. Lila expressed that a personalized approach specifically designed to meet her requirements fostered a feeling of autonomy and active participation in controlling her diabetes. The method incorporated various practical dietary adjustments, incorporating feasible exercise routines, and evaluating her medication utilization based on her routine and personal preferences. This increased levels of individualization, improving her adherence to the medication regimen, and strengthened her sense of control over her disease. Furthermore, the intervention strategy enhanced Lila's health indicators, such as her general baseline blood glucose levels, and influenced her ability to manage her weight more effectively. These favorable results further validated the plan's efficacy, directly improving her overall standard of life. Lila expressed experiencing heightened energy levels, reduced energy fluctuations, and an overall improved demeanor. The input provided by Lila and the observed changes in her health condition serve as evidence that the personalized diabetes management treatment strategy had a substantial positive impact on her overall well-being. This tailored approach successfully addressed her specific needs, fostering autonomy and active participation in her overall welfare. This is coming from Hurst et al. 2020. The positive health outcomes further strengthen the overall efficacy of the actions taken, highlighting the need of personalized healthcare in the management of chronic illnesses like diabetes mellitus. Conducting a comprehensive examination of every source is essential for assessing their authenticity and reliability in research. Writers may maintain the quality of their data by employing renowned academic databases such as the National Institute of Health, the World Health Organization, or PubMed Medical Journal database. These online sources are focused on medical studies and include filters to help identify more reliable and research-specific content, which was used to compile the relevant data for the implementation of the Diabetes Intervention Strategy Plan. In addition, the use of Capella University's web-based library search tool Summon, writers can effectively narrow down their searches by looking for only what works that were published in the last 5 years. This allows them to exclude out-of-date and unverified information that might not be relevant in the management of chronic illnesses such as diabetes mellitus. Nurses utilize evidence-based practice as an outline to provide efficient treatment in a clinical environment. Evidence-based practice incorporates the experience of healthcare professionals, the most current and highest quality research findings, and the individual preferences and experiences of the patient. This is coming from Huo et al. 2024. The application of evidence-based practice in the content of preparation and execution was essential in the formulation of Lila's intervention therapy approach. In order to accomplish this goal, a compilation of guidelines, regulatory rules, and literature assessments were made to assist in the application of self-management techniques and novel technology specifically designed for diabetes. These procedures guarantee that patients have the ability to obtain affordable healthcare treatments that include the most recent technology developments. The use of medical technology into the patient-tailored capstone care plan ended up exemplifying multiple enhancements in the patient satisfaction and improved patient communication. By adeptly leveraging various healthcare technologies, we were able to make Lila's diabetes treatment more effective. An evidence showcase of the positive benefits of utilization technology was the incorporation of a continuous blood glucose monitoring system. The technology was able to display Lila's blood glucose information to herself in real time, showing her the results of her new lifestyle changes. By offering immediate feedback, Lila was able to make educated decisions regarding her daily routine and dietary selections. Additionally, this enabled even her primary healthcare provider, real-time data to adjust her medication regimen with greater precision. Furthermore, the project effectively integrated mobile applications to monitor her blood glucose levels, providing Lila with a user-friendly platform to record her daily routine, meals, and medication compliance. Healthcare workers have the ability to retrieve this data remotely, allowing for an ongoing feedback process. The incorporation of constant communication has improved the interaction between patients and medical professionals, allowing for prompt interventions and necessary modifications. This is coming from ASMAT 2023. Additionally, hypothetical applications of technology integration for Lila's condition involve the implementation of telemedicine services, depending on affordability of her insurance coverage, and the usage of her provider's electronic medical record system to remain informed about her most recent healthcare data outcomes. These improvements provide enhanced accessibility to medical data, facilitate remote consultations, promote collaboration among healthcare providers, and optimize patient care procedures. Through the utilization of technology, healthcare professionals may offer more streamlined, tailored, and easily accessible treatment, eventually resulting in enhanced health outcomes for patients who are managing chronic diseases. I based my suggested strategies for Lila on healthcare regulations to make certain that the suggestions I made were both cost-effective and free from any obstacles related to resource availability. The implementation of the Affordable Care Act in 2010 has had a substantial influence on healthcare provision in the United States, especially among persons who are dealing with chronic diseases like diabetes mellitus. The Affordable Care Act guarantees the provision of vital medical care for Americans with diabetes mellitus and other chronic conditions by requiring medical coverage to cover persons with pre-existing diseases. The Affordable Care Act brought about a greater focus on preventative health care, leading to heightened recognition of illnesses such as diabetes mellitus and making it easier to identify and manage them at an early stage. Furthermore, the Affordable Care Act has broadened the availability of healthcare services for those with diabetes by implementing reimbursement systems such as Medicaid and Medicare. As a result, this group has now improved affordability of healthcare coverage. This legislation has had a direct impact on Lila's diabetes treatment plan, as she stated she did not seek treatment for her diabetes until she obtained her citizenship paperwork and became eligible for Medicaid. Individuals diagnosed with diabetes often incur medical costs that are more than double the average of those without the illness. The implementation of the Affordable Care Act's reforms in healthcare has the possibility to enhance the likelihood of effective management of diabetes for patients with limited resources, given the significant expenses involved in controlling the condition. This is coming from Polanki et al. 2021. Early identification through preventative medical interventions might greatly decrease death rates and dramatically alleviate the economic and societal burden on the current system of healthcare in the United States. A registered nurse with a degree at the baccalaureate level is necessary for the formulation and execution of these policies. The role of the registered nurse fulfills a crucial function in precisely comprehending and carrying out the fundamental values of patient-focused care. This is coming from TION 2023. Registered nurses act as patient care advocates, ensuring that patient ideas are needed and taken into account and integrated into the development and implementation of various healthcare efforts. The plan was effectively implemented within the context of patient-focused care, owing to the nurse's clinical knowledge and proficiency in building connections with patients and multiple disciplinary teams. The nurse's expertise and understanding, obtained through meticulous research, played a vital role in improving the patient-focused care model over time. The expertise of the nurse allows them to contribute a well-thought-out assessment of viability, challenges, and potential benefits of patient-centered processes. This data has the potential to impact policy changes that improve the range and efficacy of patient-focused care guidelines within a variety of clinical environments. When I first started my capstone project, I was confident that Lila would be a perfect choice. She had been diagnosed with diabetes mellitus for over 25 years. Additionally, she had a significant history of other health conditions and had neglected to treat her condition properly for most of her adult life due to a lack of knowledge and resources. With high expectations for the effectiveness of the treatments I implemented, I anticipated that Lila's response would be predominantly positive and advantageous, drawing from established research and literature. Given that we spent a combined total of 9 pivotal hours in each other's company, my projection was shown to be correct. Lila enthusiastically participated in our talks, regularly asked questions, and I continuously presented her with the most up-to-date supporting research to answer her issues. She showed eagerness in beginning her new weekly exercise regimen and had a sincere interest in discussing nutritional choices to mitigate the progression of her illness. Having personally witnessed the consequences of uncontrolled diabetes, she displayed sincere worry about the potential coexisting medical conditions and problems that might occur if not handled properly. This made her an ideal candidate for adhering to a care plan of such significance. Participating in continuous personal and professional growth is an everlasting endeavor. Almost a decade has passed for me personally since I graduated from nursing school, and I honestly doubted my ability to return to academia for a program such like this on multiple occasions. Nevertheless, dedicating time to contemplate and appraise this progress allows us to gauge our capacity for progress in our own areas of expertise. Upon entering this final course, I have recognized that this degree has bolstered my research abilities, which I have been using throughout my nursing profession to augment the standard of my patient care practices across the board. Moreover, it has improved my ability to authenticate the precision and relevancy of what knowledge I utilize for my patients in the future, thus preventing the use of obsolete material that could potentially endanger a patient's health, as recent data has shown the effectiveness of different interventions stemming from current evidence-based practice methods. After obtaining my bachelor's degree in nursing, my immediate goal is to transition to a different nursing specialty in a well-respected hospital that has achieved magnet status, increasing the odds of me receiving ample training as I evolve my career and practice. I decided to temporarily pause my travel nursing contracts in order to dedicate sufficient time to complete this coursework to the best of my ability. My ultimate objective is to become a hospital educator or a nursing professor in the later phases of my nursing career. This is because bedside nursing may eventually exert excessive physical strain on my body, but I still desire to contribute by imparting knowledge to the future generation of nurses. I express gratitude for the educational experience and the instructors who have significantly contributed to my professional development. The newfound self-assurance I now possess enables me to make well-informed choices and seek help when needed, therefore guaranteeing the welfare of my patients and augmenting my nursing care to be the best of my abilities. Thank you for the opportunity to apply myself, challenge my definition of what I can achieve in this lifetime, and help me realize my true potential. Thank you very much for listening.